In this module, we will review documentation, billing, and coding for patient encounters for home hemodialysis. Home hemodialysis is part of the federal government's aim to reduce cost and focus on patient preferences. Providers are incentivized to offer home hemodialysis modality options so their patients can be rewarded with lifestyle and health benefits and costs can be reduced. The goal of the 2019 Advancing American Kidney Health Initiative is that 80% of ESKD patients will receive home dialysis or renal transplant by 2025. The end-stage treatment choice models such as CKCC and KCF adjust provider payments based on home dialysis claims. Patients who want to learn this modality need proper training. Home hemodialysis training includes a 25-session course which covers the training for the patient and/or a caregiver. The CPT code is 90989. After all, home was not built in a day. For patients that did not complete a 25-session course, a CPT code of 90993 is charged per training session. For a physician to bill, they must have direct participation in the training. The provider presence and direct involvement in the training session should be documented. Retraining for home hemodialysis can be covered under certain circumstances. Some patients prefer to switch to a new home hemodialysis machine, and retraining will focus on how the new machine operates. Other reasons why patients may require retraining is that they may have a medical or mental status change. A caregiver can change or move to a new location for their home hemodialysis. The patient is at the center of the multidisciplinary team. Each member of the team is crucially important in supporting the home patient and working together to troubleshoot if problems arise. The team regularly assesses home stability and ongoing caregiver support. At each monthly visit, depending on the HHD machine, the provider may have an app to review the patient's data and treatment logs. Patients are screened for uremic symptoms and labs, and medications are reviewed. Anemia, bone disease, and blood pressure control are assessed. Access is evaluated and proper aseptic cannulation technique is reinforced. Transplant status and testing are updated. The monthly capitated payment billing code is CPT 90966, which is approximately the same reimbursement as a level 2 to 3 in-center visit. Visits can be completed by telehealth, but a face-to-face visit is required quarterly. There is no required number of visits, but providers should provide appropriate care for the management of the home hemodialysis patient. If the physician did not complete the monthly visit due to transplant, death, hospitalization, or patient relocation, then daily codes are billed for the span of days the patient was under the care of the physician. Switching modalities. The monthly billing code for home hemodialysis is billed for any portion of the month when a patient receives home hemodialysis, CPT 90966. For instance, if an in-center patient switches to home hemodialysis, or a home hemodialysis patient switches to in-center dialysis and had a physician visit, then home hemodialysis is billed. Kidney disease education. Kidney disease education has been covered only for patients with CKD stage 4. Patients are entitled to 6 one-hour visits. In the ESKD treatment choice models, stage 5 CKD patients and some ESKD Medicare beneficiaries can receive kidney disease education. Offering this service to later stages of CKD will help more patients receive their dialysis modality of choice or a renal transplant. In summary, it is important for providers to understand all allowable services for the home hemodialysis patient. Recruitment to home hemodialysis just got easier. Providers will have more time to provide kidney disease education regarding the home dialysis modality at later stages of chronic kidney disease. Kidney disease education has already been offered to patients with CKD stage 4 and now will be offered to CKD stage 5 and some ESKD patients under the end-stage kidney disease treatment choice models. Nephrologists need to document their level of participation. Patients can receive comprehensive home hemodialysis training sessions and retraining if necessary. Providers are incentivized to provide home hemodialysis under the end-stage kidney treatment choice payment models. Telehealth continues to remain an option for your home patients. Face-to-face visits are required on a quarterly basis. Therefore, patients can meet with their provider in the comfort of their own home, and all important data can be reviewed remotely. Lastly, evaluation and management visits can still be billed for non-ESKD related problems during an office visit.